I have many concerns about the health care proposal presently before the Congress. Number one of which is the tremendous cost involved. Almost everything the federal government does, the costs are lowballed on the front end, or the estimates of cost. We're given very low estimates of what the bill will actually cost. But as most people know, Medicare and Medicaid now cost far more than 10 times more than what was predicted when they were first enacted. And this bill, I can just about assure people that it will cost much more than is estimated over the next several years. And when we're entering a time where we have a deficit this year of a mind-boggling $1.4 trillion, and where we're going to face, by the most optimistic estimates of the administration, $4 trillion added to our debt just in this year and the next two. In 3 years' time, $4 trillion. It's just unbelievable. In fact, this administration will incur, and has incurred and will incur, more debt in the first just a little over a year and a half than was run up by this nation in its first 200 years. It's just getting unbelievable, and I think the reason that more people are not upset about this is because nobody can humanly comprehend a figure like $1 trillion. But what it means is, without any question, that in just a few years, we're not going to be able to pay all our Social Security and veterans pensions and all the things we've promised our own people with money that will buy anything. And the Congress at that time, 5 years or 10 years from now, won't be able to cut the benefits, so they'll just make sure that more money is printed, but then people's pensions or retirements will be worth a third or a fourth of what they expected. And so senior citizens, or particularly people who hope to retire in the next 10 or 15 years, should be very, very concerned about this. We want to make health care more affordable. That's the number one thing that people want. But the federal government has exploded costs on this problem in the first place. Before the federal government got heavily into medical care in the mid-60s, medical care was cheap and affordable by for almost everybody. Doctors even commonly made house calls. I went to reception in Lebanon, Tennessee in the early 90s, and the doctor who delivered me brought my records, and I asked him how much he charged back then, and he said he charged $60 for 9 months of care and the delivery if they could afford it. But when the federal government got into it, then medical care stopped being just primarily between the doctor and the patient, and slowly over the years, we developed all this middle industry and bureaucracy that has exploded the cost of health care and put the patients way out here and the doctors way out here, and then we've enabled all these people and companies who could manipulate this government-run system that we have and make millions of dollars. But let me, I've expressed some concerns of mine, and I could talk about this for a long time, but I'll resist the temptation because I need to keep this very short, and besides, I just hear the buzzers going off to call us for votes to the floor. But let me read something that Senator Lieberman said on Face the Nation just this week. He said the bill before us will actually hurt the economic recovery and our long-term fiscal situation, and will probably raise premiums, or it will put us further into debt. We certainly don't need to be going further into debt by any bill that we pass in the Congress. The American Farm Bureau, which has several million members and is by far our largest farm organization, sent us a letter dated yesterday that said we are opposed to an employer mandate and view an 8% payroll tax imposed for non-coverage as excessive and as burdensome as mandated coverage. And it said passing a mandate accompanied by a threat of a tax for non-compliance only makes the situation worse for people unable to afford coverage in the first place. In other words, this is going to make it much more difficult for small farmers around the nation. Maybe the big giant farmers can handle it okay, but many small and medium-sized farmers will not be able to. And then finally, let me read something that Dick Morris, who was the top political advisor to former President Clinton, he wrote this. He said, this bill heightens the likelihood of draconian rationing, lengthy waiting lists, and lower quality medical care for all of us, particularly the elderly. And he says that in Canada, in 1993, there was an average wait of 9.3 weeks to see a specialist. By 1997, the wait was up to 11.7 weeks. Now it's 17.3 weeks, over 4 months wait just to see a specialist. And Canada is a country with only 1/10 the population of ours and not nearly the crime problem. And they could much more easily handle this type of system than we could in this country. This bill is 1,990 pages. Here's what 2,000 pages looks like. And I can tell you this, it's filled with legal and bureaucratic gobbledygook and legal jargon that forces people or requires people to refer to other parts of the law. Anybody who votes for this bill, I can assure you, will only know a tiny fraction of what is in this bill. The Wall Street Journal yesterday referred to this bill as the worst bill ever. And even somebody who maybe disagrees with the Wall Street Journal at times realizes that they do have very intelligent people writing their editorials. And they said that this bill will require epic expenditures and taxation. This is not the time when we are going through a recession, high unemployment, very high underemployment, to be coming up with a 2,000-page bill that weighs 20 pounds, that nobody knows what's in it, that will require epic expenditures and taxation. This is a very bad bill because of the tremendous majorities that Speaker Pelosi controls in this Congress. I'm sure something is going to pass. But I hope that the next Congress will be able to come in and change this and make it not nearly as damaging as it will be if this bill is allowed to take effect and stay in effect in the years ahead.